have the honor now to present and introduce our next speaker, who's going to be starting here in about a minute or so. So I don't know if he's going to be joining me on screen while during the warm up. But up next to talk about, really, I think in terms of summarizing, what we've been hearing so far today on Frontiers Health Live, and really the conversations that are swirling, and the excitement that Jeff had just mentioned about, this opportunity that we have ahead of us in terms of digital health, telehealth, virtual care, all of the adjacent digital everythings that are out there. Kind of summarize what's been going on in the industry, and more importantly, talking about what will health be like in this new normal. So up next, we have the CEO of Healthware. He has been our host here today and is often the host at Frontiers Health in Berlin. So I'd like to welcome the CEO of Healthware, Roberto Acione. Roberto, are you ready to tell us, how we exist and move forward in the health of the new normal?
I am, Jessica. Thank you so much for making this intro. So you spare me the challenge to self-introduce myself. That's the unique challenge of a mixed reality event like this one. And before starting, I'm really happy that you guys, two very close friends, had this very vivid chat just before this. And this is a great prequel. It was a great prequel to what I'm about to share. So I'll be talking about healthy new normal from our own perspective at Healthware. So for those not familiar with us, Healthware was born more than 20 years ago in Italy and expanded globally. It's a unique concept, I believe, because it's a blend of a company that has been providing services, but also conceiving transformation of healthcare and dreaming all along about the power of technology, creativity, and data to really transform healthcare as we know it. And you can understand that once you come from such a long journey, a situation like this one really accelerated a number of processes, as you just heard, that we, of course, feel totally suited to our thinking and our behavior. Healthware is a unique mix of a full-service strategy, communication, and technology agency connected to the innovation ecosystem very, very closely. You see our deep relationship for Frontiers Health as an example. And we also enjoy having skin in the game through our corporate venture arm that does invest in digital health companies. So we were born digital. We'll be always forward-looking to the future of health. And of course, we look at this in a very integrated fashion. How we did respond to the COVID-19 issue. We created a strategic response model that basically started by gathering all the data, the insights, and the information that were available. We went out there to hear from patients, healthcare professionals, our clients and partners to understand the unique challenges that all these groups were facing. And we started to model potential responses by design solutions that hopefully could have been adding value to this challenge. This has been almost a gigantic proof of concept during the pandemic peak, which basically is allowing us to deploy some of these solutions very fast. Working in a total agile mode, we don't know what we don't know. So we are working to iterate those solutions, gather data, refine, iterate again, and refine the model. We're working in this fashion since the beginning of February, so we have already some data and experiences to share with you. You heard about this before. COVID-19 has probably changed forever healthcare. That was already changing before of this because of the digital transformation. So it was almost like the perfect storm. And again, I'm looking at crisis from the meaning of the ancient Greek, change. So what we can take out of it. We can take this acceleration of the transformation, which was already happening, so this was almost like a catalyzer of that transformation. Particularly, the social distancing forced everyone to find alternative ways to interact, for example, with doctors, to figure out or reframe healthcare delivery services. Are we done with that? By any stretch of imagination. But we have been put in that situation, we had to cope with it, so we have learnings. At the very least, we demonstrated that that is possible outside of the digital health innovation ecosystem, where, of course, we knew already that was possible. So in this context, all these digital solutions and tools that you are hearing about today and more basically started to play a role that will not end with the end of the pandemic peak, but we believe and hope will be the foundation of this transformation of healthcare that we believe is here to stay. People is always where change happens. We just heard about this word, and that's very important because in all other sectors where digital transformation happened, all these transformations were led by people. And the other side of probably the same medal is the concept that need-driven innovation is really key to solve the unmet needs that we do have in healthcare. And COVID-19 has been the perfect combination of these two factors. We all have clear needs, first of all, the access, and we all as people first, and then patients, and then physicians, and then even institutions, have been confronted with that and have been forced to find solutions. On the healthcare professional side, new barriers have materialized. Ongoing care has been suspended because, of course, we were concentrating on the COVID-19 cases, and we were struggling to handle all the other disease and conditions that were, of course, were and are still present. On the people side, on the patient side, a gigantic lack of clarity and uncertainty materialized, and of course, the limited access hit hard on that side of the equation too. So digital health community has been responding remarkably to this in truly unprecedented ways. We have seen globally mobilizing a number of companies, some of those you are hearing from today, taking on this challenge from unique angles, in creative ways, in different ways, pivoting what they were doing, changing the way they were doing in order to respond and demonstrate that that was possible by helping to master this challenge. And that has been quite remarkable. We have been mapping all of this, and as I said, we'll release the full map next week. This is an extract from that of course ties into the program of today that we are watching. And why is this so important for the future, for the new normal? Because thanks to this wealth of innovation and proof of concepts and even at scale demonstrations that this is possible and is now, we are able to strategize on future needs or present needs that needs to be solved, harness the richness of this innovation, co-create with these companies and roll out, whether you are a large-scale corporation in the life sciences, whether you are an insurer, whether you are a public institution that, of course, is planning for this digital health transformation. A good example has been telemedicine. Telemedicine is being conceived in the mid-60s, and we never heard so much in a few months like in 3 decades before. Why? Simply because that really connected an unmet need with a potential solution, which was kind of there, but never really scaled. Now we demonstrate that not only it works, but that can scale quickly, and can add a lot of value to people's needs, and of course, healthcare professionals too. So what about the future of healthcare in the new normal? There will be a number of solutions that will lead this transformation. Some of which that I believe will play a big role will be all the active prevention solutions that will make more meaningful the access to doctors. We will be able to leverage a lot more signals, even coming from voice, sight, body signals that passively we will be able to collect and make prediction on future healthcare stage, as well as be extremely timing in the detection of potential conditions and diseases. Platform that will be able to connect patients and doctors will play a very important role. And this will be about telehealth, remote disease management, management of complex chronic conditions, in a way that will be more and more convenient on people terms, and always more and more affordable and timely, and as soon as possible, predictive as well. On the other side, we will have more and more solutions that will be able to deploy and live much more healthier lifestyles. And that will be very important because technology will allow to keep ourselves more healthy through those solutions. And clearly, digital therapeutics will play a very big role as prescription therapy based on software interventions that will be intimately remotely administrated. Of course, this is all new. This is all new for our doctors, this is all new for our nurses, this is all new for our institutions, for most of the payers. So working to spread this information, make more research, have more scientific publication, do more education on all these topics is absolutely critical, so to make the full healthcare systems transition into this new normal, hopefully based on digital health. So let me share with you an example that comes from the modeling that we have come up with. This is applied to telehealth, to remote video-based consultations as a concrete example. So the model analyzes what we have been doing, and to some extent we are still doing, and we hope we will not have to do again because of future peaks during the pandemic outbreak. And then, of course, analyzes what is possible in the transition towards the new normal that will likely start once we will have a solution, a cure, aka a vaccine, most likely. So value during has been really respond, give access, being able to monitor people at home. An example of this, of course, has been the remote monitoring. We have been involved in quite a few of these activities, so we have been able to really jumpstart, collect data, analyze, and learn from it. From a policy perspective, a lift of certain policies has been instrumental for these solutions to be deployed and be effective. But let's look at the phase that is starting now, the post-pandemic. Those solutions needs to be rendered in the context of comorbidity, for example, in the context of a partial access, which will, of course, follow the total lack of access. From a deployment perspective, we will be able to scale those solutions to all sort of other chronic conditions that we will be able to handle through those systems. And of course, from a policy perspective, we will need to pay for this so that these companies that have been rendering those services, we will be able to thrive and keep providing these services at scale. The new normal will largely be about how we scale this, how we make those solutions the baseline of our healthcare services, how we can make those solutions available to as many people as possible, as universal as possible, so to really grow collectively based on the wealth of data and the convenience and the access that those solutions will be able to provide. This, of course, will accelerate a further paradigm shift. We tested, it works, it's possible, can be done, so let's do it at scale. And once we will do it at scale, we will enter into a preventive type of medicine where data will really be driving the conversations. The access to doctors will become more crowdsourced. We will be able to interact with more doctors, more care providers, almost at the same time. As that data will become enough and validated, predictivity will start to come to us and be able to prevent in a very predictive way certain conditions ahead of us. And also, we believe will be massively integrated. It's impossible to think that we will handle our health through 20 different apps and solutions. It's also not realistic that will be one single place to go. So we believe there will be a need for these different solutions to interact each other with standards that at some point will have to be agreed upon. So this will lead us to a world where literally we will be digitalizing everything that we can. And of course, we proved over the past years and even more during the crisis that this is possible. So this will inevitably happen. But this won't mean that we will be teleported into a technomedicine. I believe that the scaling of digital health will be the way that we will bring humanity back to care. We will be able, in other words, to provide much broader access at a much affordable price point to the masses. And through this, we will be able to not only reconfigure healthcare as we know it, but also to use that instrumentally to social development, as we clearly see that these two sides are very intertwined, and we learned this hardly over the past few months. So thank you so much for following this presentation.